So our job as the Institute of Medicine Committee was to make these recommendations to the Department of Health and Human Services. And we are now waiting to hear whether Secretary Sebelius will accept some or all of these recommendations. And once she accepts the recommendations, they'll be implemented, and plans will be required to cover these services without cost sharing. There were 8 recommendations that we found to be important in terms of not only preventing disease, but also really promoting health and well-being in women. So they include first, screening for gestational diabetes or diabetes during pregnancy for all women between weeks 24 to 28. And I think in addition to that, which on average is general routine practice, we recommended that women who are at high risk, so obese women, women with a history of gestational diabetes, that these women be screened at their first visit. We think that there's benefit clearly to the eventual child as well as to the mother. Another recommendation was that there be routine screening, yearly screening for sexually transmitted diseases for all women, for all sexually active women. Also that HIV testing, annual HIV testing and counseling be covered without cost sharing. For cervical cancer screening, in addition to routine pap smears, we recommended that high-risk DNA testing for HPV be added to women's screening exams if they have a negative pap smear. And this is recommended for women who are over the age of 30 and to occur not more than every 3 years. And we think this is important because it increases the sensitivity and specificity, or the ability for us to detect cancer, but it also enables us potentially to space out our screening for this population. We also recommended that all contraceptives, all FDA-approved contraceptives and sterilization methods be covered without cost sharing. And we have seen very good data. I think there are outstanding data as to the preventative benefit of decreasing the rates of unintended pregnancy. We also recommended that breastfeeding counseling also be offered to all pregnant women and once women give birth. But in addition, that breast pumps, the cost of renting breast pumps be covered without cost sharing. And this is important because we know the benefits of breastfeeding to the child as well as to the mother. The recommendation is for breastfeeding to occur for 6 months. The majority of women are returning back to work after a maternity leave, and it's important that they be able to continue breastfeeding and that cost not be a barrier. In addition, we recommended that screening and counseling for interpersonal violence and domestic violence be covered and undertaken for women. Women are at increased risk, and interestingly, in the past, there was a sense that maybe screening might in fact increase a woman's risk. And today we have very good data that screening and counseling can oftentimes lead to decreased risk of interpersonal and domestic violence. And then lastly, we also recommended that there be a well woman's visit, at least one well woman's visit covered without cost sharing. And if you think about it, you know, we have all of the preventative services now being covered, which is a phenomenal opportunity to promote health and well-being. But we really have to have the ability for the woman to actually go to her care provider, to actually have the counseling, to get the services. So to make sure that the visit is covered. We at the Brigham are really focused, I think, in a very powerful way on discovering sex differences in health and disease. So how do men and women differ in not only in their basic biologic function, but then how do those sex differences express themselves in disease? And then based on that data, how should we be providing care differently to women? So one of the areas that we've been focused on is that of lung cancer and sex differences in lung cancer. Another area is in gestational diabetes. We've been doing quite a bit of work in the area of not only understanding some of the risks and how we decrease risk for gestational diabetes, but also how do we care for these women with gestational diabetes, and how do we prevent future episodes of gestational diabetes. So I think it's an area that we're very focused on. Another area that we've been focused on at Brigham and Women's Hospital is really looking at the experience in Massachusetts in healthcare reform, and really understanding the experience of women and using that experience to help inform how healthcare reform is implemented or how it gets rolled out nationally. National healthcare reform and the recommendations regarding prevention, and now the addition of specific recommendations for women, really provide, I think, an unheralded opportunity to improve the health and well-being of the entire population, and in particular women.